Many people experience occasional stomach discomfort, but sometimes symptoms can signal a more serious issue. In this video, we'll explore which symptoms related to a sensitive stomach mean you should seek urgent medical care. Understanding these warning signs can help you act quickly and potentially prevent complications. Let's start by understanding what a sensitive stomach is and why it's important to pay attention to your body's signal. Sensitive stomach refers to frequent digestive discomfort, such as bloating, nausea, or pain after eating. While these symptoms are often mild, they can sometimes mask more serious conditions. It's important to distinguish between everyday sensitivity and symptoms that require urgent attention. Next, we'll discuss the difference between common discomfort and red flags that shouldn't be ignored. Not all stomach issues are created equal. While mild symptoms can often be managed at home, certain signs indicate a need for urgent care. Recognizing these red flags early can make a significant difference in your health outcome. Let's look at the most important symptoms that should prompt you to seek immediate medical attention. One of the most concerning symptoms is sudden, severe abdominal pain. If your pain is intense, comes on quickly, or is unlike anything you've felt before, it could signal a serious problem such as appendicitis, a perforated ulcer, or another emergency. Don't wait to see if it goes away, seek urgent care right away. Vomiting occasionally after eating something that doesn't agree with you is common. However, if you're vomiting repeatedly and can't keep down fluids, this can quickly lead to dehydration and may indicate a more serious underlying issue. Persistent vomiting, especially with other symptoms, is a reason to seek urgent care. Seeing blood in your vomit or stool is never normal and should always be taken seriously. Blood may appear bright red or look like coffee grounds in vomit or as black, tarry stools. These signs can indicate internal bleeding and require immediate medical evaluation. High fever combined with stomach pain can be a sign of infection or inflammation, such as gastroenteritis or even more serious conditions like peritonitis. If you experience a fever above 101 degrees Celsius, along with significant abdominal discomfort, it's important to seek urgent care. Losing weight without trying, especially when accompanied by stomach symptoms, can be a sign of a serious underlying condition. Rapid or unexplained weight loss should never be ignored, as it may indicate issues such as cancer, chronic infection, or malabsorption. Urgent evaluation is recommended. Dehydration can develop quickly if you're unable to keep fluids down or are losing fluids through vomiting or diarrhea. Signs include dry mouth, extreme thirst, little or no urination, dizziness, and confusion. Severe dehydration is a medical emergency and requires prompt treatment. If you experience shortness of breath or difficulty breathing along with stomach symptoms, this could indicate a severe allergic reaction or another serious condition. Breathing difficulties are always a reason to seek urgent care, as they can rapidly become life-threatening. Chest pain that occurs with stomach discomfort can sometimes be mistaken for indigestion, but it may also signal a heart attack or other cardiac issue. If you have chest pain, especially with sweating, nausea, or pain radiating to your arm or jaw, seek emergency care immediately. While mild diarrhea is common, severe or persistent diarrhea can lead to dehydration and may signal a more serious infection or condition. If diarrhea lasts more than 2 days, is accompanied by high fever, or contains blood, it's time to seek urgent care. Constipation is usually not an emergency, but if you haven't had a bowel movement in several days and are experiencing severe pain, vomiting, or bloating, it could indicate a bowel obstruction. This is a medical emergency and requires immediate attention. If your abdomen becomes suddenly swollen, hard, or extremely tender to the touch, this could indicate internal bleeding, infection, or another urgent problem. These symptoms should never be ignored and require immediate medical evaluation. Confusion, fainting, or feeling lightheaded can be signs that your body is not getting enough blood flow, possibly due to dehydration, blood loss, or a serious infection. These symptoms are always a reason to seek urgent care, especially when combined with stomach issues. Severe back pain that occurs with stomach symptoms could indicate problems with your kidneys, pancreas, or even an abdominal aortic aneurysm. If you experience intense back pain along with nausea, vomiting, or abdominal discomfort, seek urgent care immediately. If you develop stomach pain after a recent injury such as a fall or blow to the abdomen, this could indicate internal bleeding or organ damage. Even if the pain seems mild at first, it's important to get checked by a medical professional right away. A severe headache along with stomach pain can sometimes signal a serious condition like meningitis or a metabolic issue. If you experience these symptoms together, especially with fever or neck stiffness, seek urgent care immediately. Sudden changes in vision, such as blurriness, double vision, or loss of sight when combined with stomach symptoms, can indicate a neurological emergency. These symptoms should never be ignored and require immediate medical attention. If you develop hives, swelling of the face or throat, difficulty breathing, or a rapid heartbeat along with stomach symptoms, you may be experiencing a severe allergic reaction called anaphylaxis. This is a life-threatening emergency. Seek care immediately. Pain in the lower right side of your abdomen, especially if it's sudden and severe, can be a sign of appendicitis. This condition can worsen quickly and may require emergency surgery. Don't wait, seek urgent care if you experience this symptom. If you have stomach pain along with pain or burning during urination, this could indicate a urinary tract infection or even a kidney infection. These conditions can become serious if left untreated, so prompt medical attention is important. Yellowing of the skin or eyes, known as jaundice, along with stomach pain, can be a sign of liver or gallbladder problems. These symptoms require urgent evaluation to determine the cause and start appropriate treatment. If you experience severe stomach pain after eating fatty foods, it could indicate gallstones or inflammation of the gallbladder. This pain is often sharp and located in the upper right abdomen. Seek urgent care if this happens to you. Stomach pain that is severe enough to wake you from sleep is a red flag. This type of pain can indicate a serious underlying condition and should not be ignored. If you're awakened by intense abdominal discomfort, seek urgent care. If you are pregnant and experience severe stomach pain, vaginal bleeding, or dizziness, it could indicate a complication such as ectopic pregnancy or miscarriage. These symptoms require immediate medical attention to ensure your safety and that of your baby. Difficulty or pain when swallowing, especially with stomach pain, can indicate an obstruction or severe inflammation in the esophagus. This can quickly become dangerous, so urgent evaluation is necessary. If your stomach pain worsens with movement, coughing, or taking deep breaths, it could be a sign of peritonitis or another serious abdominal condition. These symptoms require urgent medical evaluation to prevent complications. A new rash along with stomach pain can indicate infections like shingles or other systemic illnesses. If you notice a rash and abdominal discomfort together, especially if the rash is painful or spreading, seek urgent care. Swelling in your legs along with stomach pain can be a sign of heart, liver, or kidney problems. This combination of symptoms should be evaluated urgently to determine the cause and start appropriate treatment. If you notice that you're unusually pale or sweating heavily along with stomach pain, this could indicate shock or another serious condition. These symptoms require immediate medical attention to prevent life-threatening complications. A rapid or irregular heartbeat along with stomach pain can be a sign of dehydration, infection, or even a heart problem. If you notice your heart racing or skipping beats, seek urgent care, especially if you feel weak or dizzy. Severe anxiety or panic attacks can sometimes cause stomach pain, but if you experience overwhelming anxiety with physical symptoms like chest pain, shortness of breath, or fainting, it's important to seek urgent care to rule out other causes. Extreme tiredness or fatigue along with stomach pain can be a sign of infection, anemia, or another serious condition. If you feel unusually weak or exhausted, especially with other symptoms, seek urgent care. Swollen lymph nodes along with stomach pain can indicate infection or, in rare cases, more serious conditions like lymphoma. If you notice lumps in your neck, armpits, or groin with abdominal discomfort, get checked by a doctor promptly. Difficulty speaking, slurred speech, or trouble understanding language along with stomach pain can be signs of a stroke or other neurological emergency. These symptoms require immediate medical attention. Numbness, tingling, or weakness in your arms or legs along with stomach pain can indicate nerve involvement or a neurological emergency. If you experience these symptoms, seek urgent care right away. A severe cough along with stomach pain can sometimes indicate pneumonia or another serious infection. If you're coughing up blood or having trouble breathing, seek urgent care immediately. Profuse sweating along with stomach pain can be a sign of a heart attack, infection, or shock. If you're sweating heavily and feel unwell, especially with chest or abdominal pain, seek urgent care. Blue discoloration of the lips or fingertips, known as cyanosis, along with stomach pain, can indicate low oxygen levels or poor circulation. This is a medical emergency and requires immediate attention. Severe itching along with stomach pain can sometimes indicate liver or gallbladder problems, especially if accompanied by jaundice. If you experience these symptoms, seek urgent care to determine the cause. Extreme thirst along with stomach pain can be a sign of dehydration, diabetes complications, or kidney problems. If you're unable to quench your thirst and feel unwell, seek urgent care. Unusual body or breath odors along with stomach pain can sometimes indicate metabolic or liver problems. If you notice a sudden change in odor, especially with other symptoms, seek medical evaluation. Severe swelling in any part of your body along with stomach pain can indicate fluid buildup, infection, or organ failure. These symptoms should always be evaluated urgently to prevent complications. Recognizing urgent symptoms related to a sensitive stomach can save lives. If you experience any of the warning signs we've discussed, such as severe pain, vomiting, blood and vomit, or stool, high fever, or any sudden changes, don't hesitate to seek urgent care. Trust your instincts and prioritize your health. Early intervention can make all the difference. Stay informed and take care of yourself.